Welcome! This video is part 5 of a 9-part series and is intended for state, tribe, and territory disaster behavioral health coordinators and others involved with disaster planning, response, and recovery. The learning objective for this video is to identify the essential components and proven strategies of implementing a disaster behavioral health plan. You will learn about key mechanisms and processes that put a plan into action in response to an event. There are 7 essential components to a disaster behavioral health plan. The first one is the acknowledgement of an all-hazards perspective. This means the plan must be able to respond to a variety of potential incidents. The plan should anticipate more than a single type of response and should be sufficiently flexible to accommodate events that differ in scale or type. The second component in a plan is to have precise definitions of roles and responsibilities. The plan must clearly define what services are included and the scope of those services. It should also identify who will provide what, depending on the circumstances and how long the services will be available. Your plan should reflect the organizational makeup in your state, territory, or tribe, as well as the types and quantity of resources you have available. Memoranda of Understanding, also known as MOUs, or Statements of Understanding with various organizations, are tools you can use to effectively define roles and responsibilities. The third component is activation and triggers. This component details when plans get implemented and the methods used to activate the plan. Make sure the plan clearly describes the activation process and that the plan works in various circumstances that could trigger a response. It is critical to specify the notification methods used to communicate the activation of your plan. Include multiple launching points to put the plan into action. For instance, the State Mental Health Authority can launch the plan, but so can Public Health and Emergency Management without having to wait on a specific disaster behavioral health representative to begin the process. The fourth essential component is the horizontal and vertical integration of the disaster behavioral health plan into existing federal, state, and local processes. Vertical integration means ensuring that your plan fits structurally into existing emergency management structures and processes. Horizontal integration means ensuring your plan fits across the various governmental and non-governmental organizations that have mental health and substance use resources. The fifth component is the creation and maintenance of resources. Disaster behavioral health responders are the primary resource in your plan. Training plays a critical role in supporting the plan. Drills and exercises support resource maintenance. They ensure that identified resources are capable and available to you. Training allows all participants who are part of your plan to have actual hands-on experience in bringing your plan to life. Playing out your plan will highlight its strengths and weaknesses and allow for continual refinement. The sixth component is a specific and reality-based plan. Good plans are explicit as to what is needed and realistic about what can be done. The plan should include how, who, and when to be effective. Finally, your plan should be dynamic. Anticipating potential challenges you may encounter in the plan's implementation requires you to include a strategy for responding to changes. Avoid allowing your plan to become stale and outdated. Build in a process for a regular review and a way to make adjustments in response to changing circumstances. Anticipating potential trends will give your plan an ability to adjust to circumstances that occur over time. This concludes the plan implementation video within the Promising Practices series. Thanks for tuning in. The other videos in the series will explore each of the standards that can enhance your state disaster behavioral health plan. To view an expanded version of this video, go to www.samhsa.gov/dtac/webinars-podcasts and scroll down to the Promising Practices in Disaster Behavioral Health Planning series. Established by the Substance Abuse and Mental Health Services Administration, SAMHSA, the Disaster Technical Assistance Center, DTAC, supports SAMHSA's efforts to prepare states, territories, and tribes to deliver an effective mental health and substance use-related response to disasters. For training and technical assistance inquiries, you can call SAMHSA DTAC toll-free at 1-800-308-3515 or email dtac@samhsa.hhs.gov. or you can visit www.samhsa.gov/dtac. Before we conclude, we'd like to give a special thanks to Steve Moskowitz, who contributed the original content of this video.